What corneal thickness is considered too low for LASIK? Imagine getting ready for a vision correction procedure and wondering if your eyes are suitable. One of the most important factors is the thickness of your cornea. For LASIK surgery, the cornea needs to be thick enough to safely create a flap and remove tissue to correct your vision while keeping your eye stable afterward. Typically, a healthy adult's corneal thickness ranges from about 540 to 555 microns. During LASIK, a thin flap about 90 to 160 microns thick is made. Then, the surgeon removes some tissue from the underlying cornea to reshape it, which depends on how much correction you need. For each diopter of correction, around 12 to 15 microns of tissue might be removed. After this process, the remaining corneal tissue, called the residual stromal bed, should be at least 250 microns thick to ensure the eye stays strong and stable. Many eye surgeons prefer to leave a residual stromal bed of 300 microns or more for added safety. If your corneal thickness is less than about 470 to 500 microns, LASIK might be too risky. This is because there might not be enough tissue left to safely perform the procedure without risking complications like corneal ectasia, which is a gradual bulging and weakening of the cornea that can impair vision. In practice, if your corneal thickness is below this range, your eye care professional might suggest alternative options. One such procedure is photorefractive keratectomy, or PRK, which does not involve creating a flap and can be safer for thinner corneas. To sum up, the normal corneal thickness in most adults is around 540 to 555 microns. For LASIK, a minimum of about 500 microns is generally considered safe, but many surgeons prefer to see at least 470 to 500 microns before considering the surgery. The goal is to leave enough tissue behind to keep your healthy and prevent future issues. Remember, each person's eyes are different, so a thorough evaluation by an eye specialist is essential to determine what's best for you. Maintaining sufficient corneal thickness is vital not just for the success of the surgery but also for your long-term health, especially when considering conditions like glaucoma or other diseases. Always consult with a qualified care professional to get personalized advice and ensure your eyes are in the best shape for any vision correction procedure.